It is time now for Morning Rounds, and joining us are CBS News Chief Medical Correspondent Dr. John LaPook and CBS News contributor Dr. Holly Phillips. First up, a new report on medical marijuana. 21 states and the District of Columbia now allow it, but until this week, little was known about whether it can effectively treat neurological disorders. John, there's a new study on all this. What does it say?
Well, first you have to put it in context. The reason why there is a big study is that for the very first time, we're having a drug that's being legalized by voter fiat, state by state, not by the FDA. So it's not gone through the usual FDA approval process, which is rigorous and looks for side effects and what's the dosage and what are the risks and what are the benefits. So the American Academy of Neurology took a look at the possible benefits in terms of neurological problems. They looked at multiple sclerosis and found that it was, in fact, effective for treating spasms, muscle tightness, and pain.
We've also heard about the use of medical marijuana for epilepsy and for seizures. Does it talk about that?
It does. It looked at some other conditions. It found that it was not effective for controlling the abnormal muscle and limb movements that you can get as a result of medications in people who have Parkinson's. There was not enough evidence to say whether it was effective for treating the tics of Tourette syndrome or also for treating seizures in epilepsy. Now, a little caveat there. It's not that it wasn't effective, that there wasn't enough evidence. And I think this points to the fact that it's been decades that we've had the opportunity to study this. We haven't because it's illegal. And really shame on us in terms of the medical profession that we haven't been able to figure out what the effects of it are, what the risks and benefits are. And I think now we're having medical organizations like the American Academy of Neurology scrambling to figure out, okay, let's do the studies.
Right, John. Now the researchers are really trying to catch up to the availability now and the possible promise of the drug.
Also this week, the first ever national report card on physical activity for kids gives the U.S. a long list of failing grades. Holly, this is pretty discouraging news. Tell us about it.
This is a really bad report card. So this is information. It was presented at the Congressional Fitness Caucus on Capitol Hill, and it was really just to give a broad look to policymakers about how we're doing getting our kids moving and kids' fitness overall. And this is a report card you really would not want to bring home ever. So the kids got a D- for overall physical activity because only 25% of them are up and doing moderate physical activity for an hour a day. They got a D in sedentary behaviors because more than half of the day for kids between 6 and 15 is spent sitting. And also another highlight, an F for active transportation because very few kids, less than 12%, actually ride their bike or walk to school.
Wow.
Is there a particular group of kids, though, that seems to be most at risk for getting those kinds of grades?
Well, girls are more at risk than boys, and actually they get less activity as they get older. That probably has to do with they're less likely to participate in organized sports after school. But really, this is just a tremendous wake-up call. It was the first ever report card to be presented in this way, so we really need to focus on improving the grades, essentially, for next year.
At least they've addressed the problem at this point.
Absolutely.
Well, anyone who loves an apple a day might be surprised by this news. The Environmental Working Group released a list of what it calls the dirty dozen. Apples are among the top 5 fruits and vegetables that contain low levels of pesticides, even after washing or peeling. The authors say eating organic produce lowers the risk, but if that's not an option, they also list the clean 15 foods with thick skins like pineapples, avocados, or cantaloupes. The researchers point out that the benefits of a diet rich in fruits and vegetables outweighs the risks of low-level chemical exposure.
Till death do us part is a significant promise in many couples' wedding vows. However, a new study from the University of Michigan finds the risk of divorce among older couples rises when the wife, but not the husband, gets seriously ill. John, what's happening here?
Yeah, I'm not sure exactly what's happening here, but I know what the study was, which is that they studied people who had been married for about at least 20 years of marriage. People were over the age of 50, and they looked at various diseases. Almost 3,000 marriages. They looked at heart disease, lung disease, stroke, and cancer. And they found that 31% of the couples had a divorce in that period of time. If you look at the people who got sick, it turned out that when the woman got sick, that increased the risk of getting a divorce. If the guy got sick, there was no increase from usual rate in divorce.
I thought it was so interesting, though, that the women were more often the ones who were filing for divorce, according to all of this. So what's happening, Holly? Why are women the ones more at risk for getting divorced or doing the divorce then?
Right. The this study didn't look at it directly, but it was more likely to go up when women got sick, primarily because of gender roles in society, we think. Women are the caregivers, both for kids, for the elderly, for sick people in general. And so when those roles are switched within a relationship, it can create stress. If the man gets sick, it's a more natural progression within the relationship for the woman to take care of him. Then when the woman gets sick, it can really turn a relationship on its head, which is unfortunate, but that's probably one of the factors.
Pretty unfortunate for us, yes.
They did point out that they unfortunately, they didn't know who initiated the divorce.
Right.
But it's not surprising that that would be a factor of what you said.
Absolutely.
Well, finally this week, there was exciting news about a way to regenerate muscle tissue in patients with traumatic injuries. Don Daler met the doctors behind the breakthrough.
10 years ago, a ski accident nearly destroyed the lower muscle of Nicholas Clark's left leg.
Anytime I took a step, any part of that stride where I had to balance on my left leg, I was wobbling. And those were things that weren't going to get better.
But they did. Scientists used a protein substance taken from a pig's bladder to create a scaffold for new muscle to grow. Dr. Stephen Badylak of the University of Pittsburgh School of Medicine directs the research.
This is a major step forward because many people have been trying to form new functional muscle tissue by all sorts of approaches.
First, scientists remove any cells from the pig's tissue that could be rejected. Then thin sheets are placed at the site of the injury during surgery. This material contains molecules that send a signal to attract stem cells, which then turn into human muscle cells.
The exciting thing is that we are forming brand new functional muscle tissue at a place that would not normally form, and we're making a difference in patients' lives.
Up onto your toes.
Badylak says immediate physical therapy kickstarts the regeneration process. Clark's rehab began just 2 days after surgery.
I feel like I have a natural walk where people probably can't tell when they see me that I have any sort of issue. So I feel much more comfortable in public now, too.
So, John, what's the long-term outcome for these patients?
It's not known yet. They've just been followed for several months. But I'll tell you, spectacular improvement in terms of the person we saw in this video. He said that nobody could tell that he even had a problem. He's able to actually ride a bicycle. So these are first steps metaphorically and physically, and we're going to have to see in the months to come how it all works out. But people are really hopeful.
Very
It's sort of a new frontier. Rather than just repairing an injury, it's actually creating regrowth of the tissue. It's amazing.
It's really interesting. Dr. John LaPook, Dr. Holly Phillips, thanks so much.